Good morning, everybody. I've put this presentation together with the contribution of many of my colleagues, and as you move through, you're going to see we don't quite have the same approach as other universities have been showing us. So thankfully, we've had a few speakers this morning who've really given us the foundation for why we are embarking on including this information into our curriculum. Including having no antibiotics left in the pipeline, as well as the dosing that's being given currently not matching what we are needing. So at Rhodes, we have got 4 different subject disciplines. We haven't integrated into modules with different learning outcomes like some of the other universities have moved in. So we've still got the classical chemistry, pharmacology, pharmaceutics, and pharmacy practice approach. And we have included many different aspects into each of these different disciplines, although we haven't got a specific module on antimicrobial stewardship. So we teach about the antimicrobials, where resistance happens, the optimal use and how to achieve this, as well as our pharmacokinetics into the pharmacotherapy courses. So on teaching on antimicrobials, we have quite a strong chemistry background, and we still do a lot on structures at the basis of development of new medications. Pharmacology covers all of the classical antimicrobial groups, although with the newer ones, we perhaps need to look at including those. We've got the law aspects coming in with including Section 21s and how we need to be able to acquire those. And then pharmacy practice brings in lots more of the regulations into that, and including on counterfeit medicines. The resistance mechanisms are being looked at under pharmacology. The managing pharmaceutical supply is very important when we look at things like that hang time that was mentioned earlier by the Netcare group. Choosing the correct medicines and implementing any of those changes that do need to be made. And then those policies that the National Department of Health spoke about have been included into the curriculum, as well as our health promotion, which we go out into the community to speak to them about various topics, but this is just one of them. And controlling the optimal use, we include aspects of the infection control from the basics of the hand washing, the sterile products, and further through into wound care and how to manage those. The vaccination schedule, which forms part of antimicrobial stewardship, is covered under Pharmacy Practice 3. Then we've got the microbiology aspects that others have mentioned, and the culture and sensitivity. And then, of course, the pharmaceutics aspect comes into things with making sure that the correct dosage form is used, and optimal dressings and things when we are looking at the wound care aspect. Then by the time we're reaching 4th year level with our pharmacokinetics and pharmacotherapy, there's a lot more focus on the patient and what that patient needs, including what their health status is. Are they in ICU? Aren't they? What type of medications are they requiring? Is their body able to cope with the medications that the CNS report is saying that they need to have? And then also looking at the TB and HIV aspects, which Ruth did mention of forming a minor part of the full program, that those are still covered. And then responding to what the needs of the patient are, including the IV to oral switch and the duration of medication, making sure that we give the right dose at the right time and the right antibiotic. Those all play a part together. We don't have a big, extensive tertiary level hospital in Grahamstown. We've got a district hospital where they do cover ward rounds at the 4th year pharmacotherapy level, but we don't see all of those antibiotics that are perhaps being used in bigger hospitals and bigger centres at the Grahamstown level, although we have got one master student who is working specifically with our Settlers Hospital in implementing our project there. On the research side of things, things that we have been covering, is last year we had a fourth-year project on antibiotic prescribing in the private sector with GPs. We've got some fourth years this year looking at medicine utilization evaluations, specifically on antibiotics at our healthcare center. We've also got the master's students at trying to implement antimicrobial resistance policy at Settlers Hospital. And then we've got our PharmDs in the various tertiary hospitals around the Eastern Cape, as well as some staff looking specifically at this issue. So from Rhodes' side, what I'm seeing, especially with the other universities, is that we don't have a specific course where we are focusing all our energy on this topic alone. It's being covered in very many different places, but not being pulled back together as a single integrated theme. We don't cover anything on the veterinary use and the agricultural use, and there's a whole act which allows the farmer to be able to go and get whatever antibiotic they want and include it in their feeds. We are not covering that. It doesn't seem to be anything that South Africa has a policy on yet, so I was glad to hear that Ruth said that this is one of the focuses that the National Department of Health is looking at. We could look at perhaps integrating this whole theme into an elective at the fourth year level. It's something we can look towards, and then being more involved with the rolling out of the AMS program into the hospitals around the provincial level, which has started. It's been in the Western Cape that we know of, and hopefully that's going to be rolled out into our Eastern Cape hospitals. So thank you.